Good morning. It is August 5th, 2020, 11:11 a.m. Wednesday morning. I am here to do your safety meeting. The topic today is COVID-19, and I will deal with it. I will report it on a local level, national level, and an international level. Local news. Recent increases in new local COVID-19 cases has put Will County at a warning level for one of the metrics the state uses to monitor risk for spread of the novel virus. As of the end of last week, Will County was reporting 65 new cases per 100,000 people over a 7-day period, according to the Illinois Department of Public Health. That's above the target of fewer than 50 cases per 100,000 people, meaning that the county is at increased risk. Will County was meeting target levels for other metrics IDPH uses to measure risk, including number of deaths, test positivity rate, tests performed, emergency department visits for COVID-19 like symptoms, number of hospital admissions, and intensive care unit bed availability. If a county sees worsening numbers in two or more of these risk factors, it's considered to be at a warning level that could lead to the re-implementation of restrictions to slow the spread of the virus. Will County Health Department spokesman Steve Brandy said that there has been a lot of careless behavior since July 4th when it came to abiding by public health guidance. Eventually, it catches up to you, Brandy said. The Will County Health Department reported 241 new COVID-19 cases recorded between Saturday and Monday, or about 80 new cases for each day. In total, Will County has 8,715 confirmed cases and 339 deaths due to the disease as of Monday. The county health department released a warning last week aiming to remind the public to remain cautious as positivity rates around the state have increased in recent weeks. The department specifically pointed to new cases among Frankfort residents who attended a party in Indiana, reportedly held as a substitution prom. A health department investigation discovered that up to 270 people, high school age students and chaperones, attended the event. The information is out there, but many people are falling victim to denial about what is going on, Alpesh Patel, a county health department epidemiologist, said in a news release. We must continue to follow the logical advice about preventing COVID-19 that has been there from the start. The Will County Health Department has reported increases in COVID-19 cases among young people. Back in mid-April, people of age 10 to 19 represented 1.3% of overall COVID-19 cases in Will County. As of late July, the number was up to 7% according to the health department. People aged 20 to 29 accounted for a little over 7% of COVID-19 cases in Will County as of mid-April. As of late July, residents in that age group made up about 18% of local cases. Brandy said it is important for residents to understand that the state has not fully reopened and that public life cannot resume to normalcy. That won't happen, he said, until a vaccine for COVID-19 was available, which likely won't happen until next year, early next year. We got a long way to go, he said. For more information on COVID-19 information and resources in Will County, visit willcountyhealth.org. Okay? All right. And next we'll be dealing with national news. A pandemic of the novel coronavirus has now killed more than 700,000 people worldwide. Over 18.5 million people across the globe has been diagnosed with COVID-19, the disease caused by the new respiratory virus, according to data compiled by the Centers for Systems Science and Engineering at Johns Hopkins University. The actual numbers are believed to be much higher due to the testing shortages, many unreported cases, and suspicions that some national governments are hiding or downplaying the scope of their outbreaks. Since the first cases were detected in China in December, the United States has become the worst affected country, with more than 4.7 million diagnosed cases and at least 156,830 deaths. Um, and I will also send you a video about the COVID 19, really specifically dealing with the United States. It's very important that you watch the video because it's letting you know how the cases has spiked, especially since the riots and everything that happened with George Floyd. Um, Global news, which seems to be a little bit more recent than what I just read as far as the national news, have numbers that's even higher than what I just reported for the national news. It says the coronavirus pandemic has sickened more than 18,540,900 people, according to official counts. As of Wednesday morning, at least 701,500 people have died, and the virus has been detected in nearly every country, as these maps show. I'm not showing you a map, but that's what it says. Coronavirus pandemic is ebbing in some of the countries that were hit hard early on, but the number of cases is growing faster than ever worldwide, with more than 200,000 reported each day on average. Cases worldwide leveled off in April after social distancing measures were put in place in many of the areas with early outbreaks. But as countries began to reopen in May and June, the United States was unable to contain a resurgence of the disease, making it one of the main drivers of rising case numbers around the world. On average, the United States now accounts for about a quarter of all new cases reported worldwide every day. That's a lot. The United States says this about the United States. So now we're kind of going back to national news a little bit. The number of known coronavirus cases in the United States continues to grow quickly. As of Wednesday morning, at least 4,778,800 people across every state, plus Washington, D.C., and 4 U.S. territories have tested positive for the virus, according to the New York Times database, and at least 157,300 patients with the virus have died. After case numbers fell steadily in April and May, cases in the United States are growing again at about the same rapid pace as when infections were exploding in New York City in late March. But the hotspots are now mainly spread across the southern and western parts of the country. The New York Times is engaged in an effort to track the details of every reported case in the United States, collecting information from federal, state, and local officials around the clock. The numbers in the article are being updated several times a day based on the latest information our journalists are gathering from around the country. The Times has made that data public in hopes of helping researchers and policymakers as they seek to slow the pandemic and prevent future ones. All right. Let's see here. Do I want to read this about the data? All right. Well, I got more that I could read, but I think I pretty much covered the gist of what I need you to know. I need you to understand that the COVID-19 is still real. It's on the rise again. It's not over, and you need to understand that it's not over. You need to protect yourself and protect your family. One of the things that I want you to really understand is that even though things are open back up and people are catching it, not only that, but you not wearing a mask not only affects you, it affects those who you are around, your loved ones. So when you decide not to wear a mask and not to social distance and not to follow those parameters, you put your own loved ones at risk. So I want you to really consider that. What can you do? That you can do the same thing that they have been saying from day one. Keep your distance from others. Stay at least 6 feet away from people outside your household as much as possible. Wear a mask outside your home. A mask protects others from your germs, and it protects you from infection as well. The more people who wear masks, the more we all stay safer. Now, the mask itself isn't enough. Social distancing, staying away from people, that matters as well. Wash your hands often. Anytime you come in contact with a surface outside your home, scrub with soap for at least 20 seconds, rinse, and then dry your hands with a clean towel. Avoid touching your face. The virus can spread when our hands come into contact with the virus and we touch our nose, mouth, and eyes. Try to keep your hands away from your face unless you have recently washed them. One of the things that helps is wearing gloves. If I put on gloves, I am far more likely not to touch my own face because I don't like to touch my face with gloves. Also, we will start back taking temperatures. I was never supposed to stop taking the temperatures, but I have to make sure that we are definitely back to taking temperatures. And how it goes is somebody has to be here early in the morning, and before you even exit your car, your temperature is supposed to be taken. And if it is within the right parameters, then you're okay to work. If it's higher than, I want to say 100.3 degrees, I stand to be corrected. I have to double check. I should have actually double checked this before I made the video, but I will find that out. But we will start taking temperatures immediately, starting tomorrow. Somebody will be here, either myself or somebody I have appointed to take temperatures. So this works like this. You put it on your forehead, or I put it real close to your forehead, and I take the temperature, and then I have to, that says 36.9. I have to either calibrate this instrument or convert it to Fahrenheit, make sure that nobody here is running a fever and putting anybody else at risk. I know this probably seems ridiculous. However, it is necessary that I do it because this is what the company mandates. Not only that, but it is for your protection, your safety, and the company's protection and safety as well. So I will send another video. I need you to watch it, and after you watch this video and the video I send you, please send me back a text message on the group thread, just your name, just pretty much saying that you witnessed or you watched the video. So okay, all right, thank you for watching this video, and please respond as soon as possible. Thank you.